The Prisma Health Sim Center is designed to be a safe learning environment for both our practicing clinicians as well as our educational institutions that partner with us, allowing their students to be able to engage in simulated environments that reflect the future clinical environments that they will be practicing in. This environment allows a seamless integration of technology and medical equipment so that students are able to practice the necessary skill sets prior to engaging in the environment. Or in terms of clinical staff, it allows them to be able to practice cutting-edge techniques, cutting-edge procedures in a safe environment prior to transferring those into the clinical environment.
The Prisma Health Simulation Center is a 35,000 square foot facility. We have around 40 different rooms that we can do simulations in. We use a mixture of high fidelity patient simulators and task trainers to create the most realistic and safe spaces possible. We often facilitate cardiac arrest scenarios where facilitators can practice vital skills such as CPR and medication administration. One of the most important parts about simulation is debriefing, and it's really cool to see how we can help point out areas of improvement, which in the end impacts patient care. We recently did a code workshop where employees were able to sign up and come in and practice skills that they would use during a code. We were able to identify some areas of improvement for a specific employee. Turns out about a week later, she was involved in an actual code and felt a lot more confident running the code.
The simulators that we have at the Simulation Center consist of lateral products, which are 3Gs, and there are high fidelity simulators. There are like our workhorses. We use those quite a bit for high stake scenarios. We have our low-end task trainers, which are low fidelity trainers used for day-to-day didactic procedural skills and things like that. Our model is to make sure that they are comfortable making the mistakes here. We don't want these mistakes to carry over into the real world where they're uncomfortable and they're unsure of what they're doing. So we want them to make sure that they get all the tools and the systems they need here, and it builds confidence. And so once they go into the real world, the hospital system, they know what they're doing. They're comfortable.
My team works specifically with the standardized patient program. A standardized or simulated patient is a patient that has been trained to portray certain problems or symptoms that a real-life patient would have. Novice learners are learning the basics on how to obtain a full history on any given patient, how to perform a quality physical exam, and how to communicate with a patient. More experienced learners are refining communication skills that cannot effectively be taught in the clinical environment. For example, they are learning on how to deliver bad news to a patient or a family member, how to stand up to microaggressions, or even how to keep themselves safe in a potentially violent or aggressive situation with a patient, family member, or other member in the hospital setting. Learners can practice these soft communication skills in a safe and simulated environment where it is okay to make a mistake.
One thing about our Sim Center that I am very proud of is the fact that we are able to impact the learning of all of our various educational partners in such a way to where they can take all of their skill sets and take them to the clinical environment, and they find themselves miles ahead of other individuals. Our students keep up to date with all of the new innovations that are coming through in healthcare. It gives them the ability to go back with the full confidence of knowing that when they walk into a situation that they have been given the necessary skills and practice to be able to effectively impact patient care.